So I was earlier saying, I apologize that we don't have a presentation yet because we had a miscalculation on the calendar. Who was supposed to do this presentation is having another workshop in Mauritania today. So I will just give some insight on the Toumai community. So the Toumai community is actually the French-speaking openIMIS sub-community, which provides information and support on health financing, social protection, and digital health systems to the francophone countries that are interested in tapping from the resources and getting technical support from the openIMIS community of practice. So as of now, the Toumai community has been growing progressively, and we have countries like Cameroon, DRC, Chad, Senegal, Comoros, Mauritania, Djibouti, and to an extent, other new countries that are in the pipeline who are interested in openIMIS, who are French speaking. We are working with all of these countries to see how we could provide them support in their wish to use tools like openIMIS or Core MIS. So the Toumai community, we are meeting every month, once a month. We have a community call, just like with the English-speaking implementers community, and we meet on the third Mondays of the month. And we have already established a mailing list where we have all interested participants inclusive, and we send constant reminders. And within these calls that we when we meet, because we meet not just as implementers for the Toumai calls, we meet both as implementers and developers, where we discuss on the different countries' implementations, we identify their challenges, difficulties, and we brainstorm and reflect on how we could provide support. So the countries which I had mentioned who belong to these Toumai communities are at different levels of openIMIS implementation. For example, a country like Cameroon started using openIMIS for its UHC at the later part of 2023, and effectively 2024 they had actually taken up openIMIS to scale up in the country, and as of now they already have more than 1,300 users with for the moment more than 1 million claims. And to my community, we have experienced that a country like Cameroon has a specific challenge with performance, as the number of users are quite a lot. And besides the problem with performance, which we are working actively with the different developers in the community to solve this problem, there's equally a problem of infrastructure, that is the servers that were gotten initially, because as per the need that the country defined, they needed a pilot scheme, that's a pilot openIMIS for 33 health facilities, and at the end of the day, they scaled it up to more than 1,000 health facilities on the same infrastructure. So we have this kind of challenges, but the community is very active with the Toumai community, where they use this platform to share such challenges, and the community is informed, and they are trying to see how they could come up with proposals, recommendations, and equally work on the cash solutions and other kinds of solutions. Then we have equally countries like Comoros, which is bringing in a very interesting new approaches. Like, for example, Muslim countries have their own kind of definitions for a family, where we have polygamous family. All of those are specificities that we exploit from these French-speaking countries, and we are sharing the codes with the community to see how they could improve on the generic version of openIMIS to respond to more diverse kinds of needs. Then we have Mauritania, which we had worked on openIMIS, but at the moment, work that is ongoing there is on a general perspective of the digitalization of the country's health information system. We have Senegal, which after participating in the study tour that was organized in Nepal, they immediately gained a lot of interest in openIMIS, and they took a decision not long from then to use openIMIS. And at the moment, They have already identified local developers working with support from Swiss TPH to train and capacitate these local developers to implement openIMIS. They have already gone a long way, and they are in the process of development, and soon they will start implementation. And we have other countries like DRC, Chad, which at the moment are working on the openIMIS for different purposes. So the community is available, and it provides support to all of these countries to make sure that at least when they have challenges in country, there is a platform for them to share their challenges, and they can get the response from other experts implementing different approaches in other countries. And as I equally mentioned, in Cameroon, there were equally a lot of new developments that we realized in Cameroon, which are being used now in many other countries. For example, we have the, um, the profited service package approach, which was defined in Cameroon and is now being used in Comoros and in other countries. So we are really exploiting the resources available in these French-speaking countries. But now we are now equally trying to update all the documentations found in the openIMIS wiki to be in English and French. For example, the user manual, we are going to see more on that tomorrow when we'll be doing the presentation on the user manuals. And we are equally trying to see how we could get this community more active through other social media platforms like WhatsApp groups. We have created a WhatsApp group through which information dissemination can be done faster, because sometimes when we send emails, people actually get their mails, but they forget when it is time for meetings. So we send reminders through WhatsApp. And if we equally have new information to share that we have documented in the wiki, we always try to equally we to see that we share this information equally through the wiki in French, and we send the link out for this community to easily access this information. So the openIMIS French speaking Toumai community is not new. Actually, the community was very active in 2021 right up to 2023, but at a point in time, participation was a little bit slow. But we have restarted this 2025, and it is becoming very, very, very engaged. And sorry, I forgot to mention equally Niger. A country like Niger, they used to participate very actively in the English-speaking community, but now they feel free to join the French-speaking community as the platform has been reopened. So as of now, this is the feedback we have. And as I said, I'm sorry that we knew that we were going to have a comprehensive presentation on all of these countries and their specificities, but unfortunately, the calendar was a little bit, Maxim was a little bit confused with the calendar. So if there are questions, we could answer. If there are contributions, we could all discuss on them. Thank you.